I want to welcome everyone to our three-part webinar series taking place throughout April, May, and June. My name is Jordan Hines, and I am the New Initiatives Coordinator here at the Epilepsy Association of Western and Central PA. And this series will guide participants through the GOT transition, 6 core steps of healthcare transition. Each step will be about 10 minutes, and we will have time for questions after each step. So the first presentation that we have is titled Getting Started on Transition, and this will cover steps 1 and 2, discovering and tracking. We have a fantastic lineup of expert transition speakers who will be here to help you and your family begin the process of taking control of your healthcare management to plan for the future. So this month's webinar will feature our webinar moderator, which is Dr. Miya Asato, the Associate Professor and Pediatric Neurologist at Children's Hospital of Pittsburgh, Dr. Patricia Crumrine, Professor and Pediatric Neurologist at Children's Hospital of Pittsburgh, Paulette Cantwell, a licensed professional and counselor at Cantwell Counseling, and Jeannie Brytus, the Senior Infection Preventionist and registered nurse at Children's Hospital of Pittsburgh and a family advocate. They will be providing some key concepts about transition and how to prepare your transition journey. So please join me in welcoming our speakers.
Great, thank you so much, Jordan. I'm Dr. Miya Asato, and we're really pleased to be able to present our topic today about transition. And just advance the slides here. So the goals for today's presentation are to introduce the concepts of transition from pediatric to adult care. We'll be talking about a general approach and action steps that you can take to begin the process of transition. And then we'll end with talking about some resources that can help support you in your journey for transition. And so I thought we would start out with some definitions. And so maybe Dr. Crumrine, you could talk about, what transition really is.
Welcome to all, and thank you for taking time out of your busy day to attend and participate in this. I think it is important to kind of understand, what we're talking about when we talk about transition. This is not something that's going to take place in a single visit. It's a ongoing process over a period of time that involves discussions that will take place probably beginning in early adolescence and continuing into early adulthood. And these discussions will include discussions on healthcare, educational needs, community and home sort of support services, as well as other systems of care. And I think it's important to realize that the Epilepsy Association of Western Central Pennsylvania has these ongoing webinars that will help you begin to understand this process, but will focus primarily on the healthcare aspects of this. And again, this is a longitudinal process beginning with the diagnosis of epilepsy, but will provide you with some focused preparation, as we said, to begin in young adulthood or in young adolescence. So I think to have this understanding of this being a longitudinal approach, there are going to be about 6 steps that these webinars will address, beginning with what we call the discovering process, and then tracking, and then early preparation, planning and transferring, and then completing the process. So we'll begin today with talking about some of the discovering and tracking. And I think No matter at this time, wherever you or your family is in this process, keep in mind that there are going to be a number of resources available to you and supports that you can reach out to in order to make this process a lot easier. And to kind of gauge some of this. This is a process that we begin at young ages for many families, and many families will start this process very early, even before adolescence. And I'd like to introduce Jeannie Brytus, who is a nurse clinical leader at Children's Hospital, but also the parent of a young adult whose epilepsy began at a very early point in life. And I'm going to ask Jeannie to tell us about what some of her process has been with this and some of the difficulties that she's encountered along the way. Jeannie, please introduce yourself and give us some of your history and your child's history.
Sure. As Dr. Crumrine said, my name's Jeannie Brytus, and I've been a nurse at Children's Hospital of Pittsburgh for the past 41 years, but more importantly, I'm the mother of a young adult with epilepsy. My daughter Kathleen began having seizures as a newborn, but her seizures proved very difficult to treat, and a formal diagnosis was never able to be determined. With the help of Dr. Crumrine, who was her neurologist, her PCP, and her supports coordinator, we were able to get pediatric services and supports that helped our family adjust to our new normal and helped Kathleen to have the best life possible for her. She was in a day program at the Western Pennsylvania School for Blind Children. She was transported to and from the program by a local school district van, and we even had some home nursing hours so that my husband and I could continue to work and also attend events that were important to our other children. Her doctors knew her well, and sometimes all it took was a phone call to solve an issue, and all was well. Well, when she was 14, her school began discussing the transition process with us. Well, to say that was overwhelming was an understatement. There were days we couldn't think to get past the next week, let alone 4 years away. But as a nurse at Children's, I've had the opportunity to talk with many parents of children with epilepsy and found out we had universal concerns with the transition. It was scary, so we talked a lot. One concern was not being able to see the physicians and specialists who knew our children so well. There's a history of what medications worked, what didn't, what treatments worked, what didn't, why we did things, why we didn't try other things. All that history would be lost, or so we thought, and the prospect of losing that history, the relationships we had with our providers, that was really scary for all of us. Another universal concern was what life would be like for our children after their formal education ended. IEPs would change to ISPs, but what did that mean? Would there be adult programs available? What about appropriate continuing education? And transportation had to be by public buses and not her trusted school bus. Exploring these options took time and energy that just wasn't there some days. And then thinking about navigating adult services was also daunting. When Kathleen turned 18, I needed to have official guardianship papers to even talk to the insurance company, and the adult hospitals were more apt to ask for this documentation for treatment more so than the pediatric facilities that she had been in. Social Security disability was more stringent, and home nursing care was changed. Kathleen at that time had not yet been approved for waiver funding. If you're not familiar with waiver funding, it's a state program that's designed to help individuals with intellectual disability, autism, and developmental disabilities to live more independently in their homes and community, and to provide services that promote community living. And there's several types that are available and specific criteria that must be met, so it's important to work with a supports coordinator to explore the waiver funding. There often is a waiting list. So there is a lot to do, a lot to think about before transitioning. And it is overwhelming to go through the process alone. So I would recommend tapping into as many resources that you can. And just as a side note, Kathleen's now almost 30 years old, and she's thriving in her adult life, continuing to live here with her family and also out in the community. And that's our story and our concern.
Jeannie, thank you very much for those comments, and I think your journey through this process. And I think a couple of things that Jeannie mentioned was that during the time that the child is in pediatric care, it's a very much family-centered program, and that people are much more aware of some of the social supports. There's medical homes that are available, and I think discussions about this. I think once the child moves to adult care, it becomes much more person-centered, and the family is oftentimes feels as if they're left out of some of the discussions, and the discussions often take place between the patient and the physician and not some of the other family members. And it's much more specialty focused rather than sort of looking at more of the medical picture. So I think some of the major themes that were brought out is that it's an overwhelming process, which really kind of re-emphasizes the need to begin discussion about this at an early age, so that people really begin to understand what some of the processes are. And I think discussion about who can provide care when the family no longer is able to do it. There's always, I think, a hope that families will have, and oftentimes patients themselves, that the epilepsy is going to disappear. And sometimes there are sort of prolonged periods where seizures are under control. But for many people, and Jeannie's daughter was one of them, seizures have persisted into adult life. There's all of the uncertainty for all of these various problems. And then, what are the needs and what do people need to do to begin this transition process? And I'll turn this back over to Dr. Asato to sort of begin some of this discussion.
Thank you, Dr. Crumrine. Let me just advance the slide here. So I want to talk a little bit about the values that we might bring to the transition process. And one of the values that I think is very important to highlight initially and throughout the process is about inclusion. And inclusion refers to the person, the young adult, belonging to the group, and their uniqueness is valued. And this vision of inclusion should really begin early in life so that the plans are made for adult life, thinking about what is meaningful for that person, whether the young adult is working and living away from their family, or whether they need significant care and supports. You really need, as a family and as parents, to engage the health and the education teams to help think about inclusive transition that keeps your child's uniqueness in mind. And parents may feel that they really need to work hard to advocate to get this started and keep it going, but it is an important part of the process. When we think about inclusion in education, we can naturally move towards inclusion in adult life. And for many, that may mean work or some sort of activities that are occurring on a regular basis. There are lots of youth who make it to transition age from the educational system into adult life. So across the United States population, 1 in 7 people have special health care needs. Now, other conditions can occur with epilepsy that can add complexity and other considerations to transition planning. And some of those things might include autism, intellectual disability, complex healthcare needs, mobility challenges, as well as mental health conditions. All those things can be incorporated into your student's IEP and multidisciplinary team meetings at school, as well as in the healthcare settings. So it's important to begin this conversation early, even before high school, to make a good start. It's important to know that many individuals, unfortunately, who have epilepsy may have difficulty transitioning to the workplace, and they may need supports like vocational rehabilitation, but they also may need disability and Social Security supports. Having an intellectual disability may also impact one's ability to be employed. However, to aim for the best future possible, preparing for graduation should be focused on some sort of employment or activity that allows inclusion. It can start out with volunteer work and then progress to vocational rehab services as high school comes to a close. The main thing is to work towards something that is meaningful, that can be done on a regular basis. It's important to think about maximizing opportunities during high school because, as Jeannie mentioned, there are fewer programs to support young adults after graduation. I want to talk a little bit about the adolescent brain because whether we're parents, clinicians, or teachers, we know certain things about adolescents. They're working hard to develop self-identity and to think about where they belong. How they fit into the social scene is very important and part of the developmental process. They may struggle to identify themselves as having complex healthcare needs and may think of themselves as being invincible, which is why I included the picture of the superheroes. In adolescence, sometimes we note that they might want to take more control, and this can be good because it helps them build experience and confidence. By taking risks, there is a lot to gain. Of course, sometimes this may not go well. There can be concerns about individuals getting in trouble, but it's important to try new things. The ability to participate and make decisions is one of the crucial steps in the transition process, going from pediatric to adult care. In the next talk, we'll talk about some of the strategies and the supports that can help teens who really don't take to this maturation process very easily. Dr. Crumrine, do you want to talk about why transition is important and why it may be a risky time?
Yeah, I think this is a difficult concept for both families and patients to grasp and understand. And I think there are risks involved if this doesn't occur successfully. And I think one of the important risks is that there can be loss of seizure control. And this can occur because, you know, maybe failure of understanding of medication dosages, types of medications, ways of taking these medications. Seizures can result in subsequent physical injuries. And then there is the risk of sudden unexplained death or SUDEP. And again, the possibility that there can be increased visits to hospitals and emergency room. It's hard, I think, to think about changing hospitals, clinics, doctors, and moving on. But I think if we begin this discussion at a very early age, I think it can be less overwhelming as the child and the family begin to get closer to this as they move into their high school years. If things have been going well from a seizure standpoint before adolescence, if there's a risk if we lose that seizure control during adolescence, and this can result again in increased seizures, emergency room visits. So I think it's important to talk about these concerns as a parent during your medical visits and make sure that your medical provider is helping you and your teenager to really understand all of the concerns that we've listed here. The Epilepsy Association of Western Central Pennsylvania is another resource, and there are a lot of opportunities to get support through this organization and to help with, through this journey. And I'll turn that back over.
All right, so in summary, the first steps of your transition journey are to really discover that transition is going from pediatric to adult care is a long process, but it happens over time. And this can happen at a time when other transitions are occurring. But it's important to start working on this process as early as you can, assessing the strengths and needs and developing a plan. We have to remember that adolescents are unique. They can bring a lot to the table and they need to be included to be successful. This is the end of our first talk, and now we're going to go on to tracking transition, which is part 2. All right, so welcome to topic 2, which is tracking and transition to adult care. So as Dr. Crumrine mentioned, we had talked about discovering transition in our last talk. Now we're going to be talking about tracking, which is knowing about your or your young adult's healthcare. So Dr. Crumrine, for your patients who are able to participate in learning about their healthcare, how can a young person start to track and learn about their medical history? I'm sorry, you're muted.
Yeah, this will vary a lot from one patient to another, and I think it's important to begin by understanding what the level of understanding of each of these patients is. I think one of the sort of first things that it's important for the patient to understand is what kind of epilepsy they have, and you know, what are the proper terms for that epilepsy. And oftentimes they have no concept of what their seizures look like. In this day and age with technology that we have, parents oftentimes have used their phone to take videos of seizures, and this oftentimes is helpful, I think, in showing the patient what the seizure looks like so that they have the ability to describe that to their next caregiver. Also, you know, what have some of their tests shown? What is a brain MRI? What is an EEG? What do those particular test results show? And again, because of technology that we have, it's very easy to pull up a brain MRI on a computer, show them if there's an abnormality, what that looks like, if they're interested, and also to point out EEG findings and to give them a copy of their EEG so that they have an idea of what we're talking about when we say. Next, it's important, I think, for them to understand what medicines they've taken, if they've had adverse side effects from these medications, what medicines have worked, what have not, and particularly to help them develop a seizure action plan that is appropriate for the type of seizure that they have, for the situations they're going to be in at school, summer camps, and then subsequently perhaps work employment places in the future. I think it's also an important for them to be a participant in this seizure action plan. We also want them to understand what medications they're taking, their doses, how to take them. I think another important issue is that many children in life start out taking oral solutions of medication. And I think that just transitioning from a solution to a pill can be a big undertaking. And it's difficult for people to swallow pills, and to begin early in helping them learn how to swallow pills so that taking medication becomes an easier process for them. I think there may be other treatment options that some of these patients may have, like vagal nerve stimulators, helping them to understand and to become a participant in using the vagal nerve stimulator and understanding that. And then to be aware of who are some of the other team members in their care, such as social workers in the clinic, perhaps a case manager, counselor at school. Some of their teachers can be very helpful. So I think it's, there are many sort of steps in some of this process. And again, there are additional pieces of information that can come through the Child Neurology Foundation. This is an organization that has a toolkit that is available online, and this is listed in the slides here. There's a parent and youth questionnaire that's part of that. There are various checklists to kind of go through, both for parents and the teenager, and there are some videos that can be helpful. The Children's Hospital of Pittsburgh has an adolescent medicine transition clinic, and the phone number is listed on the slides at 412-692-6677. And this also is another resource. I think the other important thing for the children in school, some of these tools can be made part of their individual education process, or IEP, such as learning to take pills, learning the doses of their medication, and some of the side effects of these. So these are just some of the ways. I think collecting and updating this information is very important. And this can be done by a parent, a caregiver. Some of the patients themselves may learn how to keep track of their medications, their seizure frequency, correlation of other life events with their seizures. And they can use other support people, such as their teachers, their therapists. And again, some of these things can be built into the IEP itself. So I think those give you sort of a starting point for some support services and some things that you can think about as a parent, a support person for someone with epilepsy. And I'll turn it back over to Dr. Asato.
Great, thank you so much. I wanted to transition over to bringing on Paulette Cantwell, and will you be able to unmute your microphone?
I am doing that right now. How is that? Okay.
So I'm happy to have Paulette join us today. She is a licensed professional counselor who works with young adults as well as families around the topic of transition. Let me go ahead and bring up your slides.
Okay. Thank you for inviting me today. I would like to address the transition from a therapeutic perspective. We'll be exploring an overview of the process and in general, and what I see in the practice and how we work with families and youth who have special healthcare needs. Then we'll go to reviewing various specific examples of how to teach the skills that we talk about in this process and build tools to help our youth transition, hopefully with confidence, to adult healthcare. Through working with families and youth with special healthcare needs, I have observed a natural continuum of steps which support transition. Let's begin with the important piece of building trust and communication. I can't overemphasize how critical that is. You know, the youth needs to have a trusting relationship with the family, parents, as well as others. And, you know, as a youth advocate, I have worked through a lot of interesting situations where there had to be trust rebuilt. And then I've also seen situations where trust is already there. But if we could think about this as a natural foundation to where we go. So next slide, please.
Mhm.
Okay, so this is a version of how basically from a larger perspective, the therapeutic environment works to help a young person and their family track through this transition process. If you see on the left, you'll see skills specifically, and then on the right, you'll see the continuum piece about the parent involvement transitioning over to the youth focus. So first and foremost, I would suggest the earlier the better if possible. Parents teach skills to their children. We can do this through teaching not only skills, but habits through experiential learning, or as many people describe it, kind of learning by doing. Examples of this include talking with your child about their doctor and how their doctor is a part of their healthcare team. You might want to ask them how they would like to participate in their medical care. Encourage youth to speak directly with their doctor during visits and ask questions important to them. So that's the first step that generally is more parent focused. The second step, practicing skills, is partnering with parents and the youth. It allows for reinforcement and confidence building. Parents are able to observe their teen using the skills that were taught. This also increases the confidence that the parents have for their children. The next step is shared responsibilities. Parents now encouraging their teen to take the first step in their care. Continue to build trusting relationships. This is an important time for parents to send the message that the relationship they understand is shifting from themselves to their youth, and focusing that on their healthcare needs. I think it's an important time, once again, circling back to that trusting relationship, to build on that, to let your youth know that you believe they can handle this, you believe they have the capabilities. And I say that meaning that there are a lot of ways youth in different spectrum that have different needs. And we all understand, we've talked about it earlier today, that there are a variety of needs and abilities. But even within that spectrum, there are many, many ways that parents and youth can work together to build confidence and certainly continue the foundation of the trusting relationship. Okay, so the next step takes on where the youth begins. It's almost like driving a car. The youth practices how to drive a car. So now they're practicing how to handle transition with parent oversight. When a young adult has the desire and the skills to take the lead in their medical care, this is why, we think of this as built over many years, and you'll see this confidence begin to bloom. Independence is shown as the youth takes control, maybe over their medication and communication with their physician, as the parent moves to the oversight role. And this is where parents need to step back. It's very, very critical that they step back and allow their youth to take the lead. The final stage is an important stage that we touched on earlier today as well. And this is more young adult into adulthood, where the youth is managing their own care with outside supports. Transitioning to adult care now includes a long-term support team for each individual. And that team is often through outside agencies who oversee the young adults' management. Parents are often included in the team and very much valued in the team, but it's important that the parents understand they function now in the role of a coach to the young adult as they manage their care. So that's the broad view. And now I'd like to touch on maybe some simple strategies that might be helpful for those listening, for both families and professionals. Examples include teach the youth to use a simple alarm, maybe as simple as their alarm clock, or maybe a watch, if they can control that, or a phone. Then the youth would alert the parents, okay, it's time for my medicine. So as you see this, they take the lead, they take the first step. Another idea is to have your youth, depending on their age, if they're a child with parent support or teen, they can participate in placing their medication in a special box or container. This encourages that medication management skill that's so critical. It's important to help them understand what each medication does for them and be available to answer questions or concerns. Encourage your youth to make a list of the items they would like to discuss with their doctor. Examples include what concerns them overall, what they believe is helpful about their care, what they need at this time, and a preferred method of communication for both themselves and their doctor. You know, as the youth progress, maybe it's through texting that they prefer, or maybe email, or maybe a video, like what we're doing today. Next slide, please. Okay. In summary, you know, I'm encouraging parents to think creatively as well as youth to think creatively. You know, for parents, build that confidence through practicing skills at home. For youth, I have seen it time and time again, experiential learning, true experiences are the best teachers. So if you could just keep those general themes in mind, I think that would be helpful. Next slide. Now I just want to touch base on technology. And of course, we know there's a wide range out there. There's a lot to say about this, but I think it's very important to understand how technology can build confidence, can be a key tool to drive that independence. They include numerous options. But with that said, many families do not have the ability to acquire the necessary technology. In this case, an option may be to access the technology through their school. That could be part of their IEP plan. Their schools have a wealth of technology through tablets or various forms of smart tech. There are apps in general that we can use for scheduling, note-taking, reminders for medication. And I particularly like, being a therapist, the apps for mindfulness. I watch that all the time, encourage youth to better manage their emotions and reach their personal goals. So in summary, the most important resource you have is the trusting relationship, which allow youth and their families to move forward in their lives. So thank you.
Thank you, Paulette. As we're finishing up here, we had mentioned that we'd like to provide you some tools, and through work with the Pennsylvania Department of Health, who helped contribute to this list, as well as the Epilepsy Association, we've compiled a list of online resources. We had mentioned the Child Neurology Foundation earlier. We have the website gottransition.org. It is really quite a massive website that I think has a wealth of information, and there is a section for parents and youth that I think is very easy to access. The Pennsylvania Secondary Transition Guide is another great online resource, as is the Transition to Adult Living. I also did want to mention that there is a service through the state called the Elks Home Service. These provide home-based supports and can be very helpful to families connect with resources. I'd like to thank all of our participants today who shared their expertise around epilepsy, going through adolescence into young adulthood, as well as working with youth and families. But I did want to turn this over to Jordan, because Jordan organizes a lot of activities through the association that he'd like to share with you. Thanks, Jordan.
Sure. Thank you, Dr. Asato. Yeah, I would really like to recommend visiting the Epilepsy Association of Western and Central PA Healthcare Transition web page, and that can be located at eawcp.org/healthcare transition. And there you'll find many different resources to get you started on your journey from pediatric to adult care. And we recently created several short educational videos that focus on transition. Some are specifically for youth, some are specifically for parents. But I think it's They're a great way to learn about transition, so check that out. And you'll find many other helpful resources that are very useful to navigate on your transition. And throughout the year, we also plan many events and programs to help youth and parents prepare for their healthcare transition. Unfortunately, some have been canceled recently, but they will be back. And in the spring, we usually coordinate our youth leadership summit, which focuses on building leadership skills and self-advocacy for youth ages 14 to 25 with a diagnosis of epilepsy. And the youth participate in fun, interactive leadership and skill building sessions to help self-advocate and effectively share their story and take control of their healthcare management. And then later in the summer, we coordinate our family healthcare transition conference, which includes both parents and transition-aged youth with a diagnosis of epilepsy. And the attendees will participate in workshops, skill-building sessions, and help them to develop goals that create a vision for a successful life as a young adult and effectively transition to the next stages of life. So some other resources are our camp programs that help provide independence and get out on their own. And we also coordinate many one-day speaker events through the Western and Central Pennsylvania.